Hi, it's Jen. I'm back with another video on our series of time, tissue, infection, moisture, and edge. Today we're still on the T's and we're going to talk about the tissue type epithelialization, which is really just a fancy word for scar tissue. So this is a little red wound that you've seen, and all this tissue around here is all epithelial or scar tissue. This is when, after our granulation tissue has reached the surface, then the scar tissue actually starts to come across and close over the wound. So when it reaches this stage, this is usually the stage where I'm like, yes, we finally made it, because again, this stage actually happens quite quickly. It's the proliferation stage, so it's where again the wound has filled and now we're developing the scar tissue. So it's very important in the wound healing process that we do get to here. We also need to know that this skin is very, very fragile, especially for a couple of years, believe it or not, after the wound is healed. Scar tissue only gains back 80% of the tensile strength that it had prior to the injury. So if you hit this or bang this or hit it on something that, again, afterwards it causes another injury, it can actually have difficulty regenerating new tissue. And every time you re-injure a wound, it loses another 20% of that tensile strength. So it is something to really make your patients aware that they want to protect it, especially if this is on a leg or somewhere that they can hit or bang quite easily. So there's a couple other things I want to note about it. Number one is with incision lines. Now I know this incision line has a bit of erythema, but that's really just irritation from the sutures itself. It's a foreign body reaction. The body doesn't really like something foreign in it, so it gets inflamed, and you're just seeing a bit of inflammation here. But what I really wanted to note was how you can actually not even see some of the incision line that was there originally. So that's also epithelial. When you're actually assessing an incision, if you actually run your finger, hopefully with a glove on, in between the sutures, you should feel a line of induration or a line of hardness. That actually indicates that there is new tissue that have formed, that the two edges have come together and that they're going to close and stay tightly closed. If you're not feeling that line of induration, sometimes you'll see these little areas where there's a little flap. The incision actually hasn't fully come together. That can happen. The line will actually show up anywhere from 5 to 9 days after the actual procedure or closure if it was a traumatic wound. And we want to make sure that that incision line is there that line of induration is there prior to actually removing the sutures. So it's also called a healing ridge. So again, that's something you can assess prior to actually doing any suture removal. Now, if you are seeing this little bit of dehiscence, sometimes you can actually just leave the sutures in a little bit longer and then allow for the two edges to join. If you're also feeling anything boggy, so if you did see something red like this and you're feeling like a little pocket underneath, or you're not feeling that line of hardness along the healing ridge, that can also indicate infection. That usually shows up somewhere between 7 and 10 days post-procedure. So something to also be aware of and note. Here's another incision line. Again, lots of redness around, but most of that's bruising from the trauma of it. So again, this isn't something that's infected, but it's definitely something that you want to be aware of when you do to remove the sutures, that again there is some trauma there, and that again if you're getting a lot of old blood or whatnot, there could potentially be a hematoma underneath. This other lovely wound, now you can see all these little holes in it. This is actually an infected plate that has occurred well past the procedure. So this procedure was done 9 months prior to this photo being taken, and you actually can see all the epithelial from the original incision is actually had healed. But then we see all these little dots. So those are actually screws that are underneath. So this is, yes, there is some epithelialization that has occurred, but it will not close over that. Because these are infected, that the body needs the infection to come out somehow, so it's going to go through with the path of least resistance, which is usually at the top of the screw heads. So again, definitely something, if you are seeing screw heads, they do need to go back to see their orthopedic surgeon and or family doctor, because again, they'll likely require hardware removal. And last but not least, I want to talk about islands of epithelialization. So when we have a large deficit, this is a lower leg, the epithelialization doesn't just all crawl across. Sometimes you actually get little spots in the middle. So there's a nice little spot in here, a nice little spot in here. This wound itself was actually about this big prior to the healing that we're seeing occurring. Yes, there was a couple other factors with this, but we won't go too far into them. But you're actually seeing new tissue growth in the middle of the wound as well. I don't believe there is a term for it, but I've always said, yay, there's islands. So that's when it can actually heal a large deficit a lot quicker. So then the wound becomes 2 or 3 small wounds versus one really big, large one. So that today is everything you need to know about epithelialization. So you're able to recognize that and know that, yes, you're on the home stretch. That's definitely one of those times where we want to be cheering our patients on, continuing to aid in their healing. And again, moisture balance is another big key with epithelialization. They still were going to require moisture to allow for the remaining wound to fully close. So sometimes we're changing from those heavier exudating products to something that's just going to add a slight bit of moisture to it so that the rest of the epithelialization can occur. All right, thanks. Have a great day.